work. We have gotten to meet so many wonderful people. Patrick Kennedy is certainly one of them. Another one of my favorites who is joining us now is Darcy Gruttadaro from the Center for Workplace Mental Health. Darcy's been an amazing supporter, a champion, a coach, and her insights and leadership are valuable nationally and have been relevant to us here in Minnesota. So Darcy is joining us from her home in the Washington, D.C. area. And Darcy, it's great to have you here.
Thanks so much, Deb. It's really great to be here. And I just can't say enough about the amazing work that you've been doing in Minnesota. This presentation and the meeting thus far, especially the CEO panel you just had, are excellent. And I'm not surprised. You really do top-notch work. So I'm really happy to be here. And I'm happy to be talking about the path forward and providing an overview of this collaborative project. We're very fortunate to have strong partners, and I'm going to talk about who those partners are. This is initiative about driving market-based improvements in access and treatment for all Americans. And it's really about the importance of leveraging the purchasing power of employers and working with employer coalitions to improve access, which we've already heard is so critically important. It has never been more important than now, given that COVID-19 is having a profound impact on the mental health and well-being of not just Americans, but those across the globe. So I'm going to kind of weave that into the presentation. And I'm going to talk about the partners in a moment, but I really want to focus on the 5 interrelated areas of this project. The real reason why access and improving treatment is so important is that for employees, their overall health and well-being is dependent on improving access to care. So this is about getting timely, effective, and affordable care. A major challenge pre-COVID-19 and a challenge that we see rising at a rapid and alarming and concerning rate. So for employers, this is also about getting what you've paid for in health coverage for employees. And I think this has been mentioned, it certainly was mentioned on the CEO panel, but employees' overall health, not just their mental health, but their overall health, and we talked about total health, is at risk if there is not access to timely, affordable, and effective care. And also, Patrick alluded to this in his discussion, but the high cost of productivity concerns around absenteeism, presenteeism, disability, retention, healthcare spending, and more are a major concern for employers. And we know that's just going to continue to grow with COVID-19 really upon us. So I do want to talk about these 5 areas because the Path Forward initiative is really about addressing these 5 areas. And this is an implementation project. So we know what works in these 5 areas. This is about making sure that we implement changes in each of the areas so that the delivery of care is, as I said earlier, timely, effective, and affordable. So when it comes to network adequacy, we really are working with health plans, and we need the help of all of you as employers and with employer coalitions to on strategies to increase the number of providers in network. We know for many people, when they need mental health and substance use care and they contact their health plan and they look at their provider list, they hear there are those that are not taking new patients, they're not accepting insurance, or if you're lucky enough to find a provider, they have typically a 3 to 6 month wait. We know that's going to become a much bigger issue with COVID-19. So we really need to see changes happen with the opportunity to have an adequate network. When it comes to measurement-based care, this is really about delivering effective care and increasing accountability in the care that's delivered. We want health plans and employers to really insist on the use of standardized screening measures and reporting on and collecting outcomes and treatment data, because we do this in other areas of medicine, and there is no reason it shouldn't be done when it comes to mental health and substance use care. We will improve outcomes by 20 to 60% based on research when we start using an approach that includes measurement-based care. Mental health parity compliance. I know Milliman is one of the sponsors of this meeting, and I really want to applaud Milliman for the 2 studies they've done showing this is a major problem in our country. We worked hard to pass federal and state laws that require health insurance for mental health and substance use to be provided on par with coverage delivered for other medical services, but we know that's not happening in this country, and we simply need to see that change. On the collaborative care side, the collaborative care model, which is a distinct model developed by the University of Washington, it has more than 80 randomized controlled trials supporting the fact that it produces better outcomes. We just need to see this model expanded. Nearly all private insurers across the country are covering the CPT cost codes for collaborative care. We just need to see it expanded beyond where it is now. And primary care providers, there's no question they're going to be on the front lines in delivering care for so many in our country as we see those with mental health and substance use needs on the rise. So we need to see expansion of this model, and we want to see employers working with their health plans to be looking at their data around the use of the codes, to be looking at their data to ensure it's being used in greater numbers, and if not, to work with providers in their network in primary care and other specialty care areas to support the implementation of this model. And then finally, on telebehavioral health, we have seen just an enormous change here. In the last month, what we've seen is mental health therapists, psychiatrists, and providers have stood up telebehavioral health across our nation. We've seen the federal government roll back regulatory requirements. We've seen practices figure out how to deliver telephonic and video-based care. What we want to make sure of, and so that's exciting, and we know we can do that. We want to ensure this continues, that we sustain the momentum we've seen happen over the last month, and that we all look at to ensure that through telebehavioral health, we have delivery that is of a high quality and that we build accountability into the delivery of care. So that's the exciting news. In terms of the Path Forward project that we've been working on, I did want to share we're very fortunate to be working with highly influential organizations. We have the Meadows Mental Health Policy Institute, which is a Texas-based group that is doing more work nationally. Of course, we have the National Alliance of Healthcare Purchaser Coalitions. The Minnesota Health Action Group is one of the members. There are 40 members across the country. I'm going to talk a little bit more about the 8 reset regions we're working with, who are doing more of a deep dive and showing a greater commitment to reforms in these 5 areas. We also have a number of national experts that are working with us on this project. Patrick Kennedy mentioned Henry Harbin, a very well-regarded psychiatrist who is consulting on this project. Matt Bowman with the Bowman Family Foundation, who has supported the Milliman studies, is also part of our National Steering Committee. The APA, the American Psychiatric Association, is part of the group that is leading this through the National Steering Committee. So we are really excited about the fact that we're helping to drive change, but we could not do this without the regional coalitions that are involved, including the Minnesota Health Action Group, and I'm going to identify the others in a moment. The influence that we are working on really is along the behavioral health supply chain. So we see benefit consultants that employers and health plans work with to develop what their benefit plans look like are key to our success. Employers, of course, all of you, and plan sponsors are key to our success and to change and reform in these key areas that are going to really impact access and treatment. Also, health plans and TPAs and pharmacy benefit managers, and of course, the healthcare system, especially primary care, but also all other areas of medicine that deliver. And mental health is delivered in multiple systems. But we certainly know that primary care will be on the front line. So we want to do all we can to support them. So this is a collaborative effort that involves national leadership, regional leadership, and really work at the local level as well. These are the reset regions that are really key to our success. And these are the regions, they're business coalitions across the country that have signed on to do a deep dive, to really commit to change. These are organizations, these business coalitions have already been out front in doing mental health work in really focusing on reforming mental health. And I have to say, working with Deb Krause and the Minnesota Health Action Group has been amazing because they have been leading and showing the way in their commitment over multiple years to mental health reform, largely in response to the needs of all of you. They recognize that mental health is a high priority for you as employer members and members in health plans and other areas, vendors, others they work with closely. But as you can see from this map, this is a project that really covers key markets within our country. So we have the Northeast Business Group that is committed to this project, representing the New York market and many large global corporations. We have the Mid-Atlantic, so we have DC, Maryland, and Virginia as part of the Mid-Atlantic Business Group on Health. And this also includes OPM, which is one of the federal government, one of the largest employers in the country. We also have Tennessee, 2 coalitions there, Florida. In Texas, we have Dallas-Fort Worth Business Group on Health and also the Houston Business Coalition. They're working closely with the Meadows Mental Health Policy Institute. So Kansas, and then of course we have the Pacific Business Group on Health and the Silicon Valley Employers Forum. So what we want to do with this is to learn about the challenges, the successes. We're going to share these with all 40 coalitions that are part of the National Alliance and really key players in helping to reform our nation's mental health and substance use care delivery system. So this is a 5-year project. We're in year 1. We are, as I said earlier, connected with some of the most influential and important experts from across the country. So we're very excited about the potential to really transform the landscape. We started this project before COVID-19. It's very timely that we are at the point we are now to really be pushing out reforms. We are talking a whole lot within our project team about telebehavioral health and what we've been able to do with that over a short period of time. We are also talking about collaborative care, given we know primary care will be on the front line. So just to really touch on the urgency of for the path forward reforms, I mean, obviously, as we heard from Patrick and others, the uncertainty, the economic downturn, the major financial pressures that people are facing will be creating a tremendous urgency for this project and for the work that coalitions like the Minnesota Health Action Group are doing. I also just want to mention that we know from the McKinsey survey that came out, as Patrick mentioned, a short time ago, showing national surveys with the number of people that are experiencing tremendous distress. We know too from a JAMA Psychiatry article that came out a short time ago that in China, healthcare workers on the front lines are experiencing an uptick of 70% in their mental health treatment needs. That's coming here. That's going to strain our already very delicate system. So we are going to have all kinds of strains happening on our critical mental health system. So we all need to be part of the solution to really address the changes that are needed in delivering mental health and substance use care. So we're so pleased to be working with the Minnesota Health Action Group to really move forward with these reforms, and let's really replicate the momentum we've seen on the telebehavioral health side in expanding collaborative care and improving network adequacy, in addressing the critical need for measurement-based care, and in ensuring mental health parity compliance. Now is the time. We need to be doing this more than ever. And there's really a lot of opportunity for improvement. So I appreciate this chance to tell you a little bit more about the path forward. I will say it's been a pleasure to work with the National Alliance of Healthcare Purchaser Coalitions. Mike Thompson is a strong CEO leader, and he's doing great work with the coalitions around these issues. So I'll turn it back over to any questions and also just say thank you again.
Thank you, Darcy, for sharing that information. Our first question, can you tell us, was it difficult to create engagement among leadership across the different stakeholder groups for the path forward, and how did you go about achieving this?
Yeah, that's a great question. I think there have been multiple. I know Minnesota Health Action Group, Deb mentioned that they did their own survey. That survey has been replicated in other states around the country. and other regions and with other business coalitions, and also with the National Business Group on Health. Mental health is a high priority for employers, period. They've seen the cost studies, they've seen the fact that depression is the number one reason for disability across the world now globally, that the World Health Organization has done studies showing that depression and anxiety, the economic impact of depression and anxiety on the workplace is $1 trillion a year. So these are figures that really show that businesses are paying great attention. The American Heart Association has a CEO roundtable. They have made mental health a high priority for them. These issues of mental health and substance use are on the minds of CEOs across the country. It is also of interest to health plans. So health plans also see the struggle in ensuring that people have access to care. So it wasn't hard to convince business leaders. The coalitions have been right on top of this over the last couple of years. And this was all before COVID. So now mental health has just become the topic du jour for corporate and health plan leaders across the country. We are at a really important time to take this on. So I would say convincing leaders was not our biggest challenge at all. What we all need to do now is come together because we know how to fix this. And the path forward has really identified the 5 areas that will make a tremendous difference. So we're ready to go full force ahead with the help of the coalitions.
Thank you, Darcy. And unfortunately, we're running a little bit over time. And so we need to move on and hand things back to Deb to introduce our next speaker. We appreciate your time today.
Great.
Darcy, thanks so much for joining us and for giving us that good overview of the path forward. I think the biggest takeaway is the path forward is not a slogan, it's not a logo, it's not this event. I mean, the path forward is a really deliberative, really strategic, really collaborative way for us to transform mental health care and outcomes. So thanks, Darcy, for sharing that with us.